Dr. Atul Abhyankar, interventional cardiologist from Surat. As we all have been experiencing 19 infection going on in our country, and we are in a lockdown, our entire lifestyle has changed from the time of lockdown, and there are various questions in the minds of my patients and in general public also. The risk of COVID-19 infection is the same whether you are a heart patient, whether you are a diabetic, or whether your age is advanced. So the chance that you will get infection remains the same. And therefore, if you observe the quarantine, that means if you observe the social distancing, if you don't let the virus reach you, then your safety is assured. However, those people like diabetics, heart patients, or those who have advanced stage, have any other diseases which lower their immunity, then these are the type of patients who, if they get the virus, then they get a more severe infection and they get many complications of infection. And that is why they are at a higher risk. If a person is diabetic, he has to make sure that he continues taking his tablets or injections as he has been taking before the lockdown. But he has to also ensure that he does adequate exercise at home, some physical activity at home, and does not increase the dietary intake. You should also keep your diet as healthy as possible, eating more of fresh fruits and vegetables and other things. Avoid eating fried foods, too many sweets, because not only in terms of diabetes, but this also has various other issues related to eating too many sweets sitting at home. For those patients who have cardiac problems, if you are taking tablets for your blood pressure, although there is some controversy going on about a couple of type of tablets called ACE inhibitors and ARBs, at present the guidelines say that do not reduce any medicines without consulting your doctor. So do not do any changes in what medicines you have been taking without consulting your doctor. What about if you need to go for a routine visit? That means you have been checking for, say, every monthly, every 2 monthly, and you want to go and get yourself checked. Unless you have some new symptoms, some new problems, or you have gross variation, avoid going physically to the hospital or the clinic if things can be managed from home by just informing your reports to your doctor. This will avoid your unnecessarily going to and come into contact with somebody who might be an asymptomatic or an positive carrier. So it is very important that you consult your doctor when necessary, but if possible, consult through a app on your mobile phone, through WhatsApp or a phone call. So avoid physically going to a clinic unless your symptoms are such that you think that an urgent attention of doctor is required and your physical visit is very essential. You have to also make sure that certain parameters, that means if it is possible to measure, you have a BP instrument at home, you have a glucometer at home, then make sure that all your parameters are measured. As I said earlier, maintain as healthy lifestyle as it permits you. If in your circumstances it is possible that you can go down and have a walk, keeping the social distance without coming in contact with other people, continue with your physical activity. But remember, the only way to stay safe is not let the virus reach you. So maintain the social distance, stay safe, and stay at home as much as possible. Thank you.